Well, I think the way state government can help in health care is to get out of the way. I'm one of those, I don't believe that health care is a right. I believe that the government and the taxpayers not only do not have the obligation, but they are prohibited from redistributing wealth. So what we need to do is to reduce the burden overall on the taxpayers, reduce the burden overall in your case on the business owners, and let the market decide if someone's going to negotiate health coverage as a benefit, then let them do that. Government should not be in the business of health care or mandates, and I have voted against mandates on health insurance. I am a big proponent of getting government out of the welfare business for a number of reasons. If you want more questions or clarity, I'm happy to answer those. But I do think that government needs to get out of it. Now, I understand that we are so reliant upon government at this point, we couldn't stop it immediately and be done. We would create chaos. So what I would do is freeze it and then have it phase out over a period of time like 10 years, which would allow us then to transition back into a private model. But I think that's number one. We have to reduce the onerous nature of the regulation and the involvement of government. Secondly, I think that we do need some tort reform. If you look at the past legislative session, we had several bills that dealt with tort reform, specifically in the healthcare industry. Representative Ted Vogt from Tucson sponsored legislation that would have dealt with a couple of things: billed versus paid issues when you're talking about the hospital. Also collateral source rule, and we were able to get that through my committee. I worked with Representative Vogt for the last year in trying to help craft this. I heard it in my committee in Judiciary. We were able to get it through the House, and then the hospitals convinced the Senate President that this was going to destroy health care as we know it, and that all the rural hospitals would go out of business. And obviously it was a doomsday scenario that I don't agree with, but they were successful in getting the Senate President to hold those bills, and so they died. So those tort reform measures did not pass this year. I hope that we can bring them back next year and get them through, but I think they will have a significant effect on the costs that people pay when they get health services.